Okay, go ahead and introduce yourself.
Yeah, so my name is Terros, and right now I am a traveling medical lab scientist.
Welcome to Youngordumbpod. My name's Marianna, and I'm interested in learning a variety of topics. But the thing is, I'm not much of a reader. Join me as I interview a mix of people in different careers or topics to see if I'm just new to adulting and haven't learned this stuff yet, or if I should have known this information already.
So, basically what I do is I run blood tests after you get your blood drawn. I can range from looking under a microscope to look at blood cells and identifying them, or running, hormone panels on people, cholesterol, trying to figure out if you had a recent heart attack, or even micro specimens, so microbiology, testing bacteria, STDs that people may have, viruses, done a lot of COVID testing as of late.
Are you the one that draws the blood, or you're just testing it?
So actually, I could draw the blood, but that tends to happen at smaller hospitals. I've kind of had a career where I just have phlebotomists that are on staff, so I don't have to do a lot of that.
So you're trained to do it, but you just don't?
We are trained.
Which one do you prefer? To draw it or test it, or both?
So personally, I like interacting with the patient. You kind of get to learn a little bit more about them, and it motivates you. For me, it motivates me while I'm working on the blood samples, because then you go, oh, I know this person because I met them and I had conversations with them.
Are you the one that calls to tell them the results, or is that the doctor?
No, doctor has to call. Sometimes, and there's varying opinions on this, the patient is allowed to call in, and they can give you a certain number. Often it's like the requisition number, which is basically just the order number that the doctor uses to request the labs. And they can say, hey, I want to know my results, here's my requisition number, and then we can give results, but we're not allowed to interpret it for them. So like, let's say you got your blood drawn for a pregnancy test, okay? And you came in, got your blood drawn, we ran it. You see that the results are posted, or you don't see that they're posted. So you call and you go, hey, I want to know what my results are, because my doctor hasn't released them to me yet. So then, depending on the place you're at, they may say, well, too bad, so sad. You still got to wait for your doctor. Or, okay, give me the requisition number and we can tell you. And then when they tell you, let's say you have a value, okay? It's not less than whatever the test is reading. All right, so like you're at 500 or whatever. Okay, I'll say you're, beta HCG, that's the hormone that we're testing for pregnancy, is at 500. I think it's normally read at like micrograms per deciliter or something.
Sure.
Okay, so they'll say that, right? That's all you get, because the doctor has to be the one to have the conversation with you and say, we saw that your pregnancy level was at this level, and then they'll say, typically this means you're this far along, depending on your result.
But you know what it means, you just can't say it.
Right.
Okay.
Yeah.
So like, really there's no point in calling you?
No, I mean, some patients are really good. They know, and they're okay with it. And other people are just curious and they want to hear it, because they may have friends who are in the field, and they'll be like, "Ooh, what is it?" Unofficially, what does this mean? Yeah.
Yeah, I wouldn't know.
Yeah.
The only person who would know, I think, is you. So.
Oh, okay.
That I know would be you.
Okay.
So, okay, cool. Nice. Do you like it?
I do. So I did kind of a non-traditional route. I didn't go straight to college to learn how to do it. The Air Force actually taught me. So I went straight from high school to Air Force, and then did my basic training. Then you go to tech school, which was in Fort Sam, Houston, and San Antonio. And that was, I think, we do that for 6 months. We're the longest tech school beside another, job code in the Air Force.
For 6 months is the longest?
6 months is the longest one beside one other job code, and that's biomed. And they do theirs for like eight or 9 months, because they only do it at Fort Sam. Because there's only a class size. When I was going through, I think it was like 12. Like only 12 people. But like my class size was about 25, and they rotate us out every 6 months. Yeah.
So is that if you weren't in the Army?
Air Force,
sorry. Is that what everyone has to do? Like a 6 months class? Like if they were outside of the Air Force, like if I just wanted to go do it.
So like if you wanted to join the Air Force and do it?
No.
Oh, okay.
No.
So like if you want to do
like
a traditional route.
Yeah.
Okay. So traditional route, you could go to university and you could do a 4-year program and you would be called what's called an MLS, Medical Lab Scientist. Or you could go to a community college, do a 2-year program, and you'll come out an MLT or a Medical Lab Technologist. So the Air Force made me an MLT because I took credentialing and everything through Air Force at first. I was an MLT. So I was able to sit for the ASCP exam. And that's basically a national board that qualifies you to practice medical laboratory in the U.S.
And everyone, no matter what route they take, has to take that.
You can take that. You can take other board exams that I've heard of, like the AMT, but I've honestly never met anybody who's taken the AMT.
It's dumb.
No, it's not dumb. It's just like different regions prefer different tests, and I've just never heard of it.
What do you mean by different regions? So like it's different throughout the whole United States? Because didn't you do this in Texas?
So, like, I think the Air Force was just able to broker an agreement with ASCP. This is just my speculation. Okay. So they're like, hey, we're training our people to know, this much about the lab field. Is there any way that we can get it transferable into the civilian side? Because it always looks nice to have more accrediting agencies backing up your education. So to have your members be able to sit for an exam that's a national recognized thing is a big bonus. The AMT thing, I've just not really heard of it. And like, let's say, I think AMT is more preferred, I don't even know where, but like I just can't think of it off the top of my head.
Yeah.
But I just know that certain regions not necessarily have a preference, but it's just more prevalent in that area.
Okay.
Yeah.
So you took AMS.
I took ASCP, which stands for American.
Did you say AMS?
No, AMT is another
Where did
course.
I get AMS from? I'm very bad with abbreviations.
It's okay. There's a lot. I don't even know what AMT is for. I don't. I hope that's the actual right term for that exam.
Okay. So you're not even sure on that.
Yeah, because it's so just not. I've not encountered it that often.
Okay.
Everyone I've spoken to or that I've worked with
took the one you took.
Took the one I took.
Okay, so the one you took, how long is it, and like how many questions? Like how much time do you have, and how many questions?
I don't even remember.
When did you take it?
I took it like years ago. Because I graduated. Okay, so MLT, I took. I finished all that 2013. No, not even. Yeah, 2013 November, and then I took the MLT exam. Like sometime, like October of 2013.
Does it? It doesn't expire?
It does. You have to re-credential by doing continuing education every 3 years. Yeah, you need 36 credits total.
But there's not like a test you have to take again?
No. Once you take it, as long as you continue your credentialing, every 3 years you renew it, then you're golden.
Okay.
Yeah.
So you took that test about 10 years ago.
Yeah.
And then you just kept on your continuing education.
Right. And then I went to NIU to do the MLS program, which is a 4-year equivalent.
Okay.
Yeah. So
but
then,
since you already had the 2-year equivalent, did you only need 2 more years, or did you need the? Okay.
Yeah, because NIU has an accelerated program. Yeah, and again, I will always promote this program because they're awesome. Shout out to Ellen Olson and Dr. Shikrani and Amanda, and hopefully I'm not missing anybody else. Oh, Dr. Brusbay. Yeah, and then anyway, done with the shout outs. So that program, they really work with you. They do a lot of kind of individual scheduling. They figure out, well, if you're an MLT and you're doing the accelerated program, they figure out, hey, what are things that you kind of want more exposure from, because in your workplace you're just not getting it as much. Because the point of an MLS education is to be a well-rounded, lab tech, right? And then once you pass your boards and everything, you can choose to work in specific departments.
Okay. Is it like state specific or just anywhere?
For like the
test.
degree? No. Okay, so the test allows me to practice anywhere in the U.S.
Okay.
Yeah.
What about the degree?
The degree is kind of like you need the degree to sit for the exam.
Mm-hmm.
Yeah. So.
Okay.
Yeah. So the degree matters to take the exam. Yeah.
Okay. Interesting.
Mm-hmm.
Are you happy with the way that you got it, or would you have chosen a different path?
So personally, I like the way I did it because I got life experience along the way, and I was an MLT before I became MLS, so that helped me a lot. Just with, normal everyday kind of life,
Mm-hmm.
I got more exposure to just interacting with people, learned more about what I truly wanted to do, and then it helped me develop a path more. Plus, I could work and make good money while I was going to school because I was MLT. Because I was getting paid at the MLS rate because the HR at the place I was working made a little oopsie and they made my my job title like something different. But yeah.
Nice.
The pay difference isn't that big of a difference. I think it's maybe $4, maybe, and it depends on the place. Yeah, some places there's not even a pay difference between MLT and MLS.
That doesn't seem right, but
I mean, it's just the way it is. I'll say it that way.
Did you know you wanted to go into blood testing?
I actually didn't know. It was my Air Force recruiter. Because I went to her and I said, hey, I want to, eventually become a doctor for the Air Force. That was my initial, not really knowing kind of like how to attain anything because none of my parents went to college. Idea of like what I wanted to do. And she's like, and I actually came to her and I was like, yeah, I want to be this job code 4N, which is a nurse assistant. She's like, no, you don't want to do that one. I'm like, well, why not? She's like, a lot of people do it, and I'm just afraid you'll get like lost in the wash, and just kind of fall out of what you actually want to do. She goes, this job code, and she shows me 4T, and she's like, this is a medical lab. You're not going to be patient facing as much, which just means interacting with patients, but you're going to learn a lot about the testing. You're going to learn a lot about what the values mean. And you're going to essentially be learning kind of introductory stuff that doctors learn when it comes to interpreting results and stuff. Mm-hmm. And she was right. I went through it, and that's pretty much what I got. I got how to interpret results, what they mean, what to look for when it comes to, false negatives, false positives, when I'm looking at certain disease states, what the patient value should be. And then if they're not whatever, then how to kind of like rule out stuff and think of something different. Mm-hmm. So it kind of prepares you in that mindset a little bit. And so she said, do that route. I did. And, then I kind of just didn't know how to be a doctor from that point. Mm-hmm. So then I was like, debating, should I go on to nursing school or should I go on to like the 4-year degree for MLS, because my idea was trying to get into med school. Mm-hmm. Plus I didn't want to spend a lot of money kind of trying to figure that out because that's expensive to do. Yeah, and it's not like I have unlimited time to figure it out either. Mm-hmm. So
you're young. Yeah, time.
Yeah, but
you were like 40. You're fine.
Yeah, whatever. I'm 29, dude. 29. So, yeah.
I keep forgetting my questions.
Yeah. Well, let me finish like where we were. So,
okay.
Basically, to be a lab tech, I said, this is not necessarily a comfortable route, but it'll get me more exposure to interpreting results, understanding them, and also kind of a refresher on stuff. And then I can go to an affordable college, I can go to a program that works with my schedule, and then take the prerequisites that are needed to apply to med school at the same time. And I was doing that. I was taking I think for a few semesters, like 21 credits, 22 credits, and I needed approval for that.
Mm-hmm.
Yeah.
So what careers can you go into with the MLS degree?
So MLS, I think you can do like forensics. You can do veterinary medicine on the lab side.
Mm-hmm.
Okay. And then you can also work in a clinical setting, or you could work in a research setting. Now, what I think MLS program, the one that I went to, prepared me most for was a hospital setting. Okay. The research setting, it's so specific, I think, sometimes when it comes to certain research, that the hospital training and stuff isn't really gonna make or break. But I think people who do have the MLS degree are gonna have a general background knowledge of what's going on clinically
Mm-hmm.
with the research, more so than the person who just kind of like does a general bio degree. Unless they worked with the primary investigator, the person who's heading the research, the entire time.
And you didn't do that?
No. I didn't do research. I didn't do veterinary medicine. I went hospital setting all the time. That's the setting I like the most.
Mm-hmm.
It makes the most sense. It's the most applicable to everything that you learn.
Because you want to work in a hospital eventually,
Right.
as a doctor.
Mm-hmm. Mm-hmm.
Very nice. So would you say, you kind of already talked about it,
Yeah.
but would you say your job is more individual based or team based?
Okay, so again, I think it kind of depends on the setting. If you're in a smaller hospital, it'll be more individual. And it not only will it be more individual just within the lab running the test, but also you'll probably be expected to be a phlebotomist. So in that sense, it'll be individual. When you're in a larger hospital, you'll have more people on staff because there's just more testing that needs to be done.
Mm-hmm.
So then you do have to kind of be more team oriented.
Do you like the team base? Because you're in a big hospital.
Yeah. So previously, before my contract job, I was in a team-based setting. I liked it. It was fun because you can talk to people.
Mm-hmm.
You can, you develop work relationships that are, nice.
Yeah.
And you can hang out with them outside of work. And
Do you bounce your results off of each other? Like if you don't know something, can you do that, or
Yeah,
is
you
it
can.
confidential? No.
It's not it's confidential in the sense that you're not just gonna tell people stuff for no reason, So if I'm looking at a microscope and I'm like, I'm kind of having a hard time determining if this is a blast or not, which is basically a cancer cell. Okay. So if I'm looking and I go, I'm kind of on the fence about it, I can get a second opinion. That does help a lot.
Mm-hmm.
Yeah. Or when you just see really bizarre things and you're like, I don't even know what to do with this.
Mm-hmm.
Then it helps a lot.
Do you think that there's certain characteristics or personality traits that go good with your position, or can anyone do it?
So I think you have to, if you're very, extroverted, probably going to have a harder time because a lot of lab people tend to be more introverted because they like the idea of helping patients. They like the idea of being involved in their care.
Mm-hmm.
They don't necessarily want to interact with them.
You don't consider yourself extrovert?
Yeah, I am, but I'm trying to move out of lab.
That's fair.
Plus, I like the
That's
phlebotomy
fair.
part more.
Yeah.
Yeah.
That's true. You did say that.
Yeah. But also, I can kind of go back and forth. I'm okay being quiet sometimes. But, if there's jokes to be made or,
you're going to make them.
Yeah, people to be talked to, then that's what I'm going to do.
I don't think I could do it. I
Like
don't
lab?
Yeah, I don't. Well, blood, just in general. I'm an extrovert, so I wouldn't like being in a lab by myself or with a small group of people.
Mm-hmm.
And then I also just couldn't draw blood and do the phlebotomy part of it because no.
Yeah.
No. How do you just? I can't.
I used to be afraid of getting my blood drawn until I started drawing other people's blood, and I was like, I'm not going to die from this, so it's okay. That's my mindset about it. The most injury that can happen is maybe my nerve gets tweaked a little bit because it hit it in the right spot that it needed to be. Mm-hmm. But that's.
And then can't you lose feeling in your whole arm?
Yeah, but it's not really. It's not really gonna happen.
But you just said it could.
Yeah, I mean, it's like you could be walking down the street, you break your ankle and fall on your face, and then you can't feel your face for a week. Like, you know.
I guess if you put it like that, yeah.
Yeah.
I guess if you have the mindset to be able to do that, good for you, because it's not for me. Okay, moving on.
Yeah.
Can you explain the travel aspect of your job?
Yeah, so there are multiple travel companies that are kind of in medicine, and this is actually my first assignment that I'm on, so I have limited knowledge on it, but I will try my best.
Okay.
So right now I work with a company, and they found a position for me, and basically I go on their website, look at available options in different states, and also different states, I forgot to mention this, have like their own license requirement. So I take the test, I pass it, that's great. But if I want to go to Florida, there's 13 states, I think, total that require a specific license. From my understanding, all you do is kind of just pay money. You pay money and you tell them that you haven't had anything negative against your license before.
You don't have to take the test?
I mean, some places, but you already took the test. You took that national exam. Like California, you have to take, well, I know this because I took it. You have to take a...
Why did you take a California one?
Oh, because I might want to go out there at some point, you know? Yeah.
You didn't wait until you were for sure going out to California?
No, because it kind of takes a long time.
Oh, okay.
And I wanted to, get out and start moving.
Okay.
So, yeah, I mean, dude, California's is expensive, though. I think it's $240.
For the test?
No, for the license.
Oh.
So you got to submit a bunch of information, and then each state is specific in what they want.
You better actually go to California then.
Well, I didn't pay yet.
Oh.
Because I was like, I submitted all the paperwork. Oh, maybe it'll expire. I don't even know. I'll find out. I might not even go there. See, that's the thing. Because...
You must be making really good money if you could just throw away $230-something.
Well, you do make good money. But also the company reimburses you. So like,
that's not bad then.
No. Yeah.
Yeah,
so
then
you
take
can,
all of them.
Right.
Yeah.
Well, they'll reimburse you one per contract. So one license per contract. So ideally you would be like, oh, well, let me just go to this state, and then you apply for your contract or whatever. You're there. Assuming you like it, you put in your request for the reimbursement, and then they reimburse you, and then you're like, okay, cool, that was free.
So you can't like go state to state.
You could, but then that gets expensive. And most contracts are like minimum 5 or 7 weeks, and it takes kind of a long time because it's the government. So they tend to be a little slow to process all the paperwork.
So when do you plan on going to California then?
I don't even know if I will. Yeah, that's what I'm saying. We'll see.
Okay, so your first one right now, and how long is that one?
First one right now is in Iowa. That one was originally from 11/17/2022 to 2/19 or 2/17/2023. I extended. So if they like you and you produce, then you have the option to offer an extension, and then they'll accept it. And if they extend it, great. Now you're going to be there for however much longer. So now I'm going to be there till 5/20, I think.
I thought you wanted this so you can travel.
Well, I also like paying off debt. So if I'm doing
You'll
that...
get paid if you go other places.
Yeah, but I'm living with my grandma right now, so it's kind of free. Yeah.
That's true, but you're also in Iowa. You could be in California.
Yeah,
and then
California,
I could come visit you in California in the summer too.
Yeah, but I won't be there in the summer. I'll be...
Why? If you end this one in May...
I'll be in med school.
Oh, that's right. You're stopping. When are you stopping? No, that starts in July.
Yeah.
So you get another, 5-week one for... You said May?
Yeah,
right?
I'll get... So I've already kind of looked into it. It's like 7 weeks.
Yeah.
So I'm not going to do California, though. I probably, honestly, will do Southern Coast. Because, like the Gulf. The Gulf. California is just so expensive. The money is really good, but you have to also take into consideration the housing. Yeah. You still got to, live somewhere. And hotels cost a lot of money.
Get it like an Airbnb.
Well, right. I could do that. But, sometimes Airbnbs are expensive, too. There's a website called Furnish Finder. That's probably probably shouldn't be saying names because, there's like no ad support, but
True.
but anyway, there's websites out there that you can use to look for affordable housing. But California is an expensive state, so
they don't give you a stipend?
They give you a stipend, but I don't want to blow. You're not really profiting if you're blowing your stipend on the house, because most people are going to have a house in the state that they actually live in. Right?
Yes.
Like if you're doing this, and unless you're like single, no responsibilities, and then you're just floating around, which I am, but I have debts to pay. So I'd rather be in the rent-free place.
But it's Iowa. You have the opportunity to go work somewhere making good money, and you're going to stay in Iowa.
Yeah, your priority changed, man. I'm 29.
I guess.
Right? Aren't you 25?
No.
How old are you?
I'm 23.
What?
Don't do me like that. 25? Oh my gosh, I'm so offended.
That's right, because you just graduated. I don't know, dude.
I'm so offended.
It's hard to keep track of ages. Well, no, you'll be 24. You'll be 24 this summer, won't you?
Yeah, in July, in like 6 months from now.
So? You were just telling me.
And that's still not 25. So.
All right. It's close.
Okay, well, you already answered my next question of how soon you can choose your next assignment. You just extended yours.
Yeah. So basically, they kind of contact you, I think a month is the rule. A month before this one expires, because it takes sometimes a little bit to get the next one. Because they have to make agreements and stuff with the hospital that's taking you.
So then in May, when you're done with the Iowa one, you go to school in July? So are you going to do another one, or are you going to try to extend your Iowa one again?
So it depends. We'll see. Like if I can pay off all my debts before this one ends, then I can go somewhere else, Yeah. I just like rent-free, because right now I'm trying to also like have someone else take over my apartment so that I don't have to pay rent on it.
So what is your favorite part of your job right now?
Favorite part? Honestly, I really like meeting new people and interacting with them. It was fun. And people have interesting life stories. You learn a lot about them. And then you just kind of develop, new connections.
And is this like patients or your coworkers?
Like coworkers. Yeah, I have actually barely seen patients. The last patient I saw, she was like, "Where's the bathroom?" They told me it was over here. And I was like, "Oh, yeah, it's just right over there." Yeah.
What's your schedule like?
It's 2 to 10:30 p.m.s. So most labs are 24 hours unless you work.
Wait, what did you say?
2 to 10:30.
Oh, okay. I heard. Okay.
What? I said it's p.m.s.
Yeah, I heard like 2 to 2 to 2. I don't know what I heard.
Okay, well I was gonna say because I was working 12 to 8:30, but I was like, okay, well I'm not gonna say that because right now I'm 2 to 10:30.
2 to 10:30. Every day of the week, or just Monday through Fridays, or?
So it's Monday through Friday every other weekend, and most places will do that because that's how you attract travelers. You're not okay. I think like travel positions that post really wonky weekends. You're not going to get a lot of travelers. Why would they do that if you can just go to another place that pays similarly? Might not be in the place you want, but at least you're not going to work wonky weekends. Like a Saturday here, a Sunday there, or sometimes places will be like, well, we'll just call you when we need you. Who wants to do... Nobody wants to do that. Why would you travel unless you're paying boo-foo, like more boo-foo money than the boo-foo money you're getting? Why would you do that?
So the point, they make the schedule around letting you experience the place that you're traveling to.
Well, no. Because you're there to help.
Yeah, but you said like every other weekend because they know.
Yeah, I mean every other weekend because that's a normal schedule that most people work. It's every other weekend. Yeah. So like I'll work, Monday through Friday, Saturday, Sunday off. Then the next week I work Monday through Thursday, Friday off, Saturday, Sunday, and Monday off. Tuesday through Friday, Saturday, Sunday off. Yeah.
And you like that?
I do.
Do you have friends in Iowa?
No.
Or you just
I just moved
grandma?
there. Well, no. Dude, I'm actually really busy. Like I'll go to work, I'll go to the gym, I'll find like a restaurant or something. Yeah. I was doing like, dating app and stuff, but
You stopped.
yeah, because it's just,
There's no good options in Iowa?
No, not that. It's just, there's people out here who I've, started stuff with, so.
How often do you come home?
I've been coming home, almost every weekend. But I'm also trying to get stuff out of my apartment. So that's really why.
When does your lease end in your apartment?
August. Officially August. That's why I'm trying to get everything out, find someone to get there.
It's January.
Yeah.
You have 8 months.
So?
I'm just saying,
but you're missing the point. The point is, the sooner I get stuff out, the sooner I don't have to pay. See what I'm saying? The sooner someone else takes over...
Oh,
The sooner someone else takes over the lease, I don't have to pay. Yeah.
So you're trying to find someone?
Yeah, which I have prospects, so we'll see.
Very nice.
Yeah.
So no friends in Iowa.
I mean, there's the coworkers, but I don't have time to hang out with them at work. Except one dude, I'm probably gonna start hanging out with him. Yeah, it's pretty cool.
I feel like you should make friends since you're gonna be out there for another 4 months.
Yeah, but I'm only 2 hours away. I mean, I could make friends, but dude, I'm telling you, I'm busy.
Yeah, but once you get rid of all your your apartment and you find someone to live there, then where are you gonna? You just gonna stay with your mom?
No, I'll
stay with your lady friend.
Maybe. No, I'll probably. Well, here's the thing. I won't have rent to pay for. So most places on websites, it's $800 a month. So if I I can pay $800 a month because the stipend every week is more than that.
You still get the stipend right now.
Yeah. Why wouldn't I get the stipend now?
No, I guess that makes sense. Yeah.
You always get the stipend because you have to have a place to live.
Yeah.
Yeah. So
the stipend is more than $800.
Yes. And you can look at this is public information. It's called GSA, GSA per diem, which is, I can't remember what GSA stands for, but per diem is how much money you get per day. So it tells you per the area, and every state's different because they realize that every place has different costs of living. But the base, I think, is $10.99 a week. So $1,099 a week. Not taxed.
So you're getting paid for your job and you're getting the stipend. So you are making a profit, a good profit.
Yeah, it should be. That's why you do it. No one's gonna do it because it's fun. It's fun.
It's fun.
It's fun, but also you make money. Fun can't be the only reason.
See, I think that you're not taking advantage. I mean, it's good that you're living free, but you could be living somewhere nice. You know?
But I have bills to pay. I want to look. If I'm in med school with bills, how fun is that? That's zero. That sounds less fun than having fun now.
But here's the thing: you're going back to school to be a doctor, so you're gonna have more debt. So you might as well enjoy your life right now while having debt, before you become a doctor and you have to be on call and you're working all the time, and you have no kids and no family. So this is the time you should be in California, even if it is more expensive and you still have debt.
You need to get finance people on this show to tell you, take that soundbite, take it, and then get someone who's in finance, and then be my cousin said that this is not good advice. Can you tell us why?
I'm living life over here.
That's great.
I mean, I don't have debt, but I have bills to pay.
Well, I have debt and bills to pay.
I paid off all my debt. So I'm good. I didn't have a lot, so it was easy to pay off.
Yeah.
But
well, hopefully Biden pulls through. Probably not, but hey, we'll see. Yeah.
Okay, I'll stop attacking you.
It's not an attack. I mean, I get it. Believe me, do I want to do that? Yes.
You really should.
No, I gotta pay my bills, dude.
I don't know. Sometimes you just have to be irresponsible.
No. Not when you're 29. Maybe if I was 22, 23, maybe. Probably not, because it's competition.
Not even if you were 23.
No, dude. Look, my point is to be the best and be ahead. I'm not gonna do things to put me behind.
Why do you care about being ahead? You should just worry about yourself.
That is me worrying about myself.
Is being ahead
of everyone else.
Yeah, okay. No. I'm trying to go on vacation. I'm trying to buy a new car. I'm trying to get a new patio. I don't care about other people. That's the stuff I want.
Okay.
So what do you mean by putting yourself ahead? What is your measurement of
to not be in debt, so that I don't have like debts to pay while I'm living off debt? Because that's what you're doing when you go to med school. You're just going to be living off debt. Mm-hmm. I'm not, a Fortune 500 billionaire or whatever.
Not yet.
Not yet.
Mm-hmm.
So while I'm in med school, not being that, I'm going to do the responsible thing now. Yeah, I know. Believe me, if I didn't have to, I wouldn't.
Did I ask you the next question?
Which was?
Your least favorite part of your job?
Oh, least favorite part? Least favorite part is the lack of funding that lab gets. They have to fight tooth and nail for stuff.
Like equipment to do the job?
Equipment and just sometimes people just forget about the lab. I've heard stories, and I actually worked at a hospital, Bolingbrook. They forgot about the lab when they were making the hospital, and then when they're going through their final sweep, yeah. So when they're going through their final sweep through, they're like, "Where's the lab?" And they had to build it in the basement because it was the last available space.
How do you do that? Don't they have people who work at hospitals helping build it? No?
I don't know. I cannot say. What I do know is people who have not worked in the lab are more than likely the people
who are building it.
Building the hospital and the lab.
But so that it's just underfunded. There's no specific part about the job responsibilities that are your least favorite?
Let's see, job responsibilities. I personally don't like receiving specimens because it's so arduous, and then sometimes the nurses don't put the collection time and date on the specimen. Mm-hmm. And I'm of the opinion that they should come down and fix it. And this is going on YouTube. Probably going to be unpopular. If you collected the sample and you didn't put the right date and time, I'm supposed to reject the sample. Okay? Mm-hmm. Now, since I operate under the leadership of other people, I say, hey, what am I supposed to do in this situation? And they tell me what I need to do. And I say, okay. I'm of the opinion that I should be at least having them come down to fix it themselves. But sometimes they're just like...
So what do? You just call them?
Well, you can call them, or some people are like, well, you just change the time, 5 minutes before you received it, 5 minutes before the order came in.
But doesn't it matter when it was given to you?
Thank you. Thank you. You're not even in it, and you said you would never do it, and you understand that. Thank you. Yes.
Should I become one now? I think I'm qualified, right?
Yeah, you could definitely do the IT side of it, because that's struggling. IT, I don't do IT. I have no idea what they're doing, which is probably why it's the best job, because then you can just make up a problem. Who else is going to know but an IT person? Why would the IT...
What do you mean IT? What is IT about?
Information technology.
Well, I know what IT is.
Okay, right, all right. So what do you mean? What about it? How are they involved?
Yeah.
Okay, so my software to tell everybody electronically what the results are, that's basically how you're involved. So how the test is ordered.
Just filling in a bubble of what it is. You just type in not pregnant, and then
no,
or you type in whatever BET you said earlier. So that's you. I don't know. I thought you said pregnancy was BET.
Oh, beta HCG. Yeah, so that's the name of it. It's a big. That's okay, dude. It's a big word. We call it beta HCG. It's not even that. It's not even called that. It's called what is it called? Beta human cryonic hormone. I can't even remember what it's called. Gonadotropin. Human cryonic gonadotropin.
That's a pregnancy test.
That's what it's testing for, yeah. It's the hormone that releases when the fetus is in the mom. I think it's through the placenta or something.
Interesting.
Yeah.
So you need IT people to work that stuff.
To basically build the code for the system that everybody uses to look at the medical record. Or for the instrument, because I'm running most of these tests on instrument, very little things are done manually now, which is like there's pros and cons to that. There's more pros, obviously, otherwise people wouldn't do it. But then the cons are the IT issues that you can run into, because there's older systems that people will still use because it saves money. Because ultimately, what I've noticed in healthcare right now, it's coming down to the almighty dollar. So a lot of places have the idea that we're going to cut costs in areas where patients will not see the effects. Okay, because obviously it's all about like PR relations. So they'll cut costs in the lab. They won't let lab have the latest and greatest. Okay, and that software that we use needs to be like helped, updated frequently, and looked into so that things can cross properly. So like it's run on the instrument, it goes into like the ether and then crosses into whatever system the doctors and nurses uses. Okay. Will IT build the codes and the interface between the instrument and the electronic medical record system?
Yeah.
Yeah. So that's like
what is an uncommon fact about your industry?
An uncommon fact. Oh. Doctors and nurses do not run your lab tests. It's medical lab people who never talk to you.
I guess that's fair.
Yeah. Because, okay, so this is another thing. People's first impression of the lab is a phlebotomist, because that's the person who's there collecting their blood or taking their urine sample or sometimes stool sample, okay? So they're like the face of the lab, and then they don't see anything that happens behind the scene. So to them, it's just, oh, you took my blood and voila, there are my results. And it's not like that. The doctors and nurses are waiting for us to tell them, like, kind of how to proceed. Because let's say you're getting a medication, and it's like nephrotoxic, dangerous to your kidney. The doctor, in theory, should be waiting for the nurse, if they're like in the hospital, to collect the sample, send it to us, and then we say, is it a safe level or not? And then pharmacy will review it and then recommend a new dose or not, and then the doctor will proceed to like how to prescribe it. So yeah, that's not really known. Like nobody knows that. So that's why time is so important on the sample. Because you don't want a sample that says a random time and it's not the real time that the blood was drawn, because every drug has a half-life. So like while the patient's getting the drug, it's running through them and also deteriorating on its own at the same time. So
do the doctors know how to interpret all of that, or they read what you write about
So
it?
they know. So it depends. Like most doctors are going to know kind of the general stuff. Okay, and then we have like nice little notes in there too next to results sometimes, because you cannot, it is literally impossible to know everything about every single lab test ever. It can't be done. That's why there's certain departments. Okay, so that's why you have pathologists who are doctors who work specifically in lab, and that's their specialty. Their specialty is lab. So, let's say, when you get your pap smear.
Sure.
You've never gotten a pap smear?
You want me to
Pretty
see
sure
this on video?
It's like, you go to the OB-GYN, all women do it, okay? Okay, good, okay. So, pathologist, looks at the cervical cells, okay, and identifies if there's any problems or whatever, writes it up in a report for your OB-GYN to look at. They won't look at the pap smear. Some do, it just depends. But most of them send it to a pathologist because they're specially trained to always kind of look for that stuff, and they're more accustomed to, knowing what stains to use to look at certain things, right? So they'll type up their nice reports and put it for your OB-GYN to see. Your OB-GYN will look at it, interpret it, and kind of put it in a digestible form for you to see and say, oh, okay, is this something I need to be concerned about, or am I okay? And then if it is, how do we proceed if it's concerning? And then if it's not, when's the next time we need to see, and what should we look out for in the future?
That makes sense, I guess.
Mm-hmm.
I feel like there's just like little jobs that you wouldn't even think about other people like having. Like when I get my blood drawn at the doctor's,
Mm-hmm.
I think that those people are the ones like testing it and looking at it. Like I don't think that there's someone like you there.
Yeah, yeah, exactly. Yeah, we're the invisible, like, part of the hospital, and we get blamed for everything. So what I've heard is that sometimes when nurses like mess up the draw and we have to reject the specimen, which for some reason they all think that we love doing that. No, we care about the patient just as much as you. Just because we're not in front of them doesn't mean we care any less.
Mm-hmm.
So we'll have to reject the sample because we care about specimen integrity. Like, I can't report bad results to the doctor. So if it's not collected right, I have to say, yo, you got to recollect this. All right. And what I've heard from people who have come from, like the CNA side, the nursing assistant side, and they come to lab, they're like, yeah, we would use the excuse of, oh, lab needs more, or, lab had an error with whatever, so we have to collect more. It kind of all the blame gets placed on the invisible people, which, I mean, it makes sense, but also at the same time, it's like, bro, come on.
Well, what kind of things could be wrong? Like if you don't have enough?
Yeah, if you don't have enough, or you collected it in the wrong container, Like, let's say, okay, so
why does it matter what container it's in?
Yeah, so there's one container, it's a purple top, all right, and it's called KEDTA, which is basically just a fancy long word for an anticoagulant. Okay, now the way it works is it binds calcium, okay, and it also already has potassium in it, which is where the K comes from in the KEDTA.
Oh, there's like stuff in them. They're not,
It's not just like a tube that's colored because we like colors.
Yeah, that's what I thought.
Yeah, okay, I guess another uncommon fact.
Yeah, those stuff mean things. Like I figured like the purple top is like for pee, and like other stuff is like semen and stuff like that, but I didn't know that they have like certain chemicals inside of them that help get it tested.
Yeah,
interesting.
because you want, like, there's certain tests that look for certain things, so you don't want, like blood that clots, okay? You can't run that through an instrument that wants to look at all your blood cells, because they're just all stuck together. They're not going to look at all your blood cells. It's just going to jam up the machine. So the KEDTA, which is a purple top, prevents the blood from clotting by binding calcium, because EDTA will bind calcium, and I think the potassium is there.
Yes.
Yeah. So, your blood will just remain in that fluid state. So then you put it on the instrument, does its special things, looks at all the cells and says, hey, we think, that these are the cells and this prevalence and yada yada. Okay?
How many different ones are there? If you had to like guesstimate.
Oh, like tubes to collect?
Yeah.
A lot, because there's so many different.
No, like a number.
I don't know a number because let's say a number. I mean, there's a set that people normally get drawn. It's called a rainbow set. All right. There's a blue top. There's a red top. Okay. The blue top has an anticoagulant, stop your blood from clotting. Okay. The red top lets your blood clot. There's a yellow top, lets your blood clot. There's a green top that lets your blood clot. Now there are multiple types of green tops. That's what I'm saying. It's like gets complicated. There's more than one blue
100.
top. There's like 30. Let's say 30.
Oh.
Because there's also blood culture tubes. There's also, it could be 100. I just don't.
You don't work with them.
Yeah. I just know that there's a lot. Yeah. There's ones that have like an acid in them so that it can select for certain metals. There's ones that are called metal-free. So where they get processed, the tubes themselves, where the tubes get processed, they have, procedures in place to make sure that there's no trace elements in these tubes. So you'll never find because I think they run the blood when it's collected in that tube on what's called mass spectrometry. And it basically just scatters your blood and arranges it in what would it be called, like a band pattern, and then the machine looks for certain I don't even know how to describe it. It basically looks for certain metals. Okay, if your tube is contaminated with those trace metals, then your results are going to be wrong. So like, let's say copper. Your body has copper in it. Like, it uses copper. Very, very trace amount. Okay? But there could be copper in the air right now. It's just so insignificant that it doesn't matter. But if I'm testing it on a machine that's going to look for copper, I have to make sure there's no other copper in there.
Yeah.
Yeah.
That makes sense.
So there's just a bunch of different tubes.
Yeah.
Because there's tests that are very, very special and very, very specific, and there's some that just aren't. Like the red top, it's just a tube with plastic. Yeah.
So what is the time frame? Like, if I go get blood drawn and they say we'll know your results in like 5 to 7 days, like, is that accurate? Is it actually taking that long, or are they just saying that to allow like buffer time in case the doctor doesn't have time to call me?
It's buffer time for the doctor. So typically this is what's going to happen. Okay, you go in, you get your blood drawn, all right, because the doctor put in the order for you to get your blood drawn. Okay, your blood gets drawn. Now, if it's in a hospital, it'll get run that day. Okay, more than likely, unless it's a special test, it'll get run that day. But the doctor has other patients to see. So unless it's something that we call a critical value, where we'll call the doctor and say, this patient's in danger because their whatever level is too high to be considered safe. Okay, then they'll get back to you quicker. But if it's normal,
can I say that just to get it done quicker? Like, oh, I feel very like unhealthy.
No.
Can you run my no? Okay.
Yeah, and like if you're feeling unhealthy truly, then you'll go to the immediate care or the emergency room.
What recommendations do you have for people coming in to get blood drawn?
I would drink a lot of water. Okay. So don't drink coffee because that tends to like tighten up your veins a little bit. And then I would also try and just like stay warm. Even if you're like starting to get hot and you're like sweating a little bit, stay warm so that your veins and stuff are like filled. And
like
they rise to the
how
surface.
many hours beforehand?
I mean, like you can do it like an hour beforehand.
Stay warm.
But the water
Drink
stuff has
water.
to be done like a few days before. So like consistently.
A few days?
Yeah, like drink water well, okay, a few days before so that you're hydrated. And then try and stay warm before you get your blood drawn.
An hour before.
Yeah, an hour before. Okay. Wear short sleeves and then wear a jacket that you can just unzip and take off. Yeah. And then if you really, really want to be proactive, if you regularly work out, your veins will be good and you probably won't have problems. There are rare exceptions where people's veins are just very, very tiny, very, very small. But
Do I
the
have
more...
good veins?
Yeah, I think so. I mean, yeah, I should have a tourniquet, but like, I'm pretty sure if I like put a tourniquet there, that vein would show up. There you go. Yeah, that's a good one.
Thank you.
Yeah.
Thank you.
Yeah.
Are there certain foods that people should avoid?
No, but that's all your doctor's going to tell you stuff like that because some tests do require that you don't eat certain foods before. Some tests require that you eat no food at all before. But your doctor will tell you that stuff.
Okay, this question is not for me.
Okay.
Well, I'm asking it, but it's not for me because I don't do this.
Yeah.
Is there ways that like people could avoid drug testing, like showing up positive? I don't do drugs. That's not for me.
Yeah. Not that I know of. I really don't know or look into that, but I know that if they're going to do like mass spectrometry pretty sure we just call it mass spec. Okay. I'm pretty sure no matter what they're going to know because it detects, remember I was saying those trace elements? Yeah, it detects like trace elements of like anything. So if they're going to do that, you're just out of luck. But like, you are. I mean, honestly, I think the best thing to do is just not do the drug or get the drug that you need to take, like approved by your physician. That's what I honestly think.
I don't think people do that.
Yeah. Well, no, they
Definitely
don't.
not.
But I mean, I don't know of any ways. Nor would I like advocate for those ways. I sincerely don't know. Yeah.
Okay.
Because I've never like tried out Smart System. Yeah.
Me neither.
Uh-huh.
No, you haven't.
No, yeah, I believe you.
What advice would you give someone looking to be part of your field?
I would say this is a great field to do if you want a job out of college. Okay? And I'll say this to anybody who's thinking of going to college. Do not go to college if your degree does not directly transfer into a job. If you go there and you get an arts degree and you're not planning to like work for a firm that is going to guarantee hire you because you have an art degree, don't get your art degree. If you, any degree, do not get unless it transfers directly into a job. Medical lab science, guess what job I got? Medical lab science, that's right. Right out of it. And pretty much a lot of people in medical lab will get a job where they do their internship. So you do internship for about 9 months, I think. 2 semesters. You're going to get a job. So
what is one thing in your career that you, like your career path, that you are glad happened?
That I got into med school. I'm really glad about that.
Okay, getting into med school. That's an accomplishment, though.
Yeah.
Congratulations. Is something you would have done differently in your career path?
Something I would have done differently. Honestly, nothing. Because I got like a good amount of life experience. Took me a little bit, but that's okay. This is part of the path. Yeah.
Okay, so I've wrapped up the question portion, and I want to play a game now.
Oh, okay.
But before that, do you have anything else you want to say about your career or about your position that I didn't ask you about or that you didn't already say?
No, I think we touched on like only go to college if you want to do professional stuff.
Okay.
All right. Seriously.
That is the main takeaway that you want people to know.
Really? Yeah, it is.
Okay.
Yeah.
Not to get into your field of work, nothing like that.
No, I mean, yeah, you'll get into it if you want to get into it. But don't do it if you just want a certificate. Don't do that.
Okay. Don't go to school if you don't need to.
Yeah.
So, I have Quizlet pulled up.
Okay.
And I'm just going to test you on stuff.
Okay, sure.
List 2 complications in venipuncture.
I didn't know she talks.
Yeah.
Yeah, did you hear her though?
List 2 complications that happen in venipuncture.
Yes.
Okay. You miss the vein, or the vein collapses.
Those aren't answers on
All right. Well, I mean, are there options like A, B, C, D?
It's just a list of things that could happen, and what you said was
The
not.
patient could pass out.
Yeah, like that.
Oh, okay.
So say two.
Patient could pass out,
Mm-hmm.
or you could misidentify the patient.
This says, what is that, by the way? Venipuncture?
Venipuncture, it's a fancy word of saying needle stick.
Oh, okay.
Yeah, because it's like puncture vein is what it means.
It says seizures, nausea, vomiting, pain,
Oh,
or
okay,
syncope.
okay.
Syncope.
Syncope, passing out.
Syncope.
Yeah.
Yeah.
Yeah. Okay. Seizures, I don't know.
I will give
Seizures.
that to you. I'll ask 5 questions, so that's you have 1 out of 1 right now.
Oh, okay, cool. Thank you.
List 3 to 4 tests done in chemistry.
Beta HCG, like we talked about. It's a pregnancy one. No?
It's not listed on
Okay,
here,
that's
but
fine.
I mean, I'll give that one to you if you
okay.
can list.
I mean, it's a hormone that's run on chemistry analyzers only.
yeah.
Yeah. Okay, there's, you know what lactic acid is?
Is that what makes you throw up?
It's like a waste product of, anaerobic metabolism.
You're not getting these right. That's not listed on here either.
Quizlet, the almighty Quizlet, oh my god.
Keep going though.
Okay, then there's like cholesterol panel, is that on there? I don't know what tests are run in chemistry. Like what?
I would just read
Like,
it.
are they abbreviations?
It's glucose,
Okay.
drug testing, protein, albumin,
Albumin, which is a protein. Yeah.
vitamins,
Okay. Yeah. B12 and all that.
and triglycerides.
Let me see the word. What does it say? Triglycerides, which are
You
fats.
can't see that.
So like cholesterol. That's
Yeah.
okay. Yeah.
Okay.
Yeah.
So 2 out of 2.
Thank you.
List the 3 main constituents.
Mhm.
Did I say that?
Is it
I need to have her
Constituents?
read these.
okay?
List the 3 main constituents in urine.
3 main constituents in urine: WBC, RBC, and epithelial cells.
What are these big words? No.
Is that what it says?
No.
Does it say leukocytes?
No.
Okay, what does it say?
You have to like dumb it down a little bit. Like use like English and not scientific
Okay,
words.
white blood cells,
No.
red blood cells. Okay, what? All right, I don't know what it's asking. 3 main constituents in urine? What, like water?
Yeah.
Oh, okay, water, protein, and cells.
Oh my gosh, no.
What does it say?
Urea,
Oh, okay.
water, and creatine. You're kind of bad
Okay.
at this.
All right.
I'm not giving that one to you.
All right, I'll
So
take
you
that
have
one.
2 out of 3.
All right, 2 out of 3.
Maybe this one you get. List
Alright.
3 tests found on a urine dipstick.
Oh, leukocyte esterase, nitrate, and bilirubin. Is it any of
Yeah.
those? Yeah.
Yeah, it says pH and then protein, ketones, glucose, what is it?
Bilirubin.
Bilirubin, and nitrate.
Okay.
So 3 out of 4. Why are these all about urine?
Are you on just like a Quizlet that's just specifically for urine?
No, it's medical lab science.
Okay, do a different. Don't do another urine one.
Okay.
Yeah, because there's so much more.
List 2 to 3 conditions that would disqualify you as a blood donor.
Oh, okay. So HIV. Like if you're positive for HIV, you're disqualified. Hepatitis, you're disqualified, and that can be A or B if you have a current infection of hepatitis A. So I'm pretty sure we test that on donors too. All right, and then another one is syphilis.
Okay, list other things beside diseases.
Oh, too low of a hemoglobin. But I'm telling you, that's like one of the things.
It might be, but not according to Quizlet.
Okay, hold on. Okay, so not diseases.
No.
What would what's a disease
No, they're
Yeah.
not diseases.
that disqualify you? Like just things that
Just
disqualify
things
you?
in general.
Okay, getting a tattoo within, like, what is it, 6 months? Or being to prison? Or,
Being in prison,
yeah, if you're in prison,
you can't be a blood donor?
you cannot be a blood donor. Like, there's a certain amount of time. Because, okay, the infectivity, I think, of hepatitis is really high because sometimes, you get shanked and, like, those shanks aren't clean. Or, I think it's jail. If you spend more than 24 hours in jail or something, you can't donate. And the reason is because they, I think, make the presumption that you had like some type of relationship with a man while you're in there. Pretty sure.
In 24 hours.
Get more than 24 hours. I think. Don't quote that on me. But I'm pretty sure. Because it's like, no one's going to really say. You know what I'm saying? Like, no one says what happens.
The person might say, I know.
Their chances are they won't say. Like, the fact that they even ask...
That
dude,
could
I
literally
did a
happen
whole
outside
presentation.
of jail.
Right, but they ask you the question, have you slept with other men within, like, ever, actually. Like, ever. And I think there's a certain amount of time where you cannot... It used to be, if you've ever slept with a man, you're not allowed to donate. It used to be that way. And now it's like, if you haven't slept with a man for like 6 months or 3 months, I don't know. Sometimes they change it. I did a whole presentation on like why the rules against donating blood if you're a gay man are not homophobic. They're not. It's all about statistics and prevalence, and we found that that population has the highest incidence and prevalence of HIV per any other demographic in the U.S.
But
and they only make up 2%.
Before they become a donor, can't you just?
You can test it. Okay.
Yeah.
Now, let's say we test it. Okay. Your initial test comes up negative.
Mm-hmm.
When you're tracking HIV infection, you're supposed to test it 3 months. Your initial, right? Initial exposure, 3 months and 6 months. Okay?
Mm-hmm.
To make sure that you actually don't have HIV. So let's say you have your initial exposure, all right? And you're allowed to donate blood.
Mm-hmm.
Okay? And you say, hey, yes, I do sleep with men. Hypothetical scenario where they allow gay men to donate blood. I think within less than 6 months. Okay? Hypothetical.
Mm-hmm.
If you came in, or, whatever gay man came in, initial exposure, donates blood, great intentions, okay, doesn't think he has any infection, partner doesn't think he has any infection, donates the blood, it tests negative, then they dispense a blood product to a patient who needs it.
Mm-hmm.
Okay? Patient gets tested again or starts displaying symptoms after donating blood. Then patient is found out to have HIV. Well,
Yeah.
you've just dispensed that blood product to you don't know how many people. And then it becomes more difficult to track who received this person's blood. It's exactly how HIV spread so rampantly throughout the U.S. population and why children were getting it, specifically hemophiliac children who need blood transfusions on a regular basis.
Mm-hmm.
That's when the FDA and the CDC actually started taking it really, really serious. Because for a long time, pharmaceutical companies were just ignoring it, and they were like, oh, we don't want to do the testing. They weren't even doing testing because they were like, oh, it costs too much money. Until children started getting sick from HIV and dying of AIDS.
That's crazy.
Dude, it's all about money. So
That is crazy.
Yeah, so it's all about money. So that's why I think, like, the jail thing, because
Mm-hmm.
how many people are willing to, like, be like, yo, I was in jail and, like, this happened? Not many people. And that's fine. I understand it. So to rule that out, they just go, yo, have you been in jail within so many months? And then you say yes or no. And then, oh, yes, you have. Okay, sorry, you can't donate blood yet. Why don't you wait? I think there's a certain time period. It's all available.
So
on
after that time
FDA.
period, do they have to get tested for HIV?
Yeah, I mean, you should. Like,
But if they're in jail and they know that nothing happened.
Right. Well, then, okay, yeah. If you're in jail, nothing happened, and you were never, like, exposed to any bodily fluids that could potentially, like, transmit that to you,
Mm-hmm.
then, yeah, like, just wait the amount of time. Because they're going to test your blood. But the point is, if they're testing your blood and you have been exposed, but you come up negative, you can still transmit the disease.
Mm.
Yeah.
That wasn't an answer on here.
I know, but that's...
That was interesting, though.
Since we went into that, yeah.
That was interesting. Do you have any more guesses of what the answers could be? Or are you just giving up? You got
As
the
to
diseases.
why you cannot donate. I said
Yeah.
tattoos, right?
Yeah.
Yeah. So that's 2.
No, that's not listed on here. You can't be a blood
Okay.
donor if you have tattoos?
No,
Or- you said after
within a certain amount of time. Yeah. Mad cow disease, right?
No
Oh,
more
being
diseases.
traveling outside of the U.S. within a certain time period. Is that one of them? Really? Tell me the answers then, because this is what's going on.
It's a weight, age, or temperature, or illness.
The things that qualify you or disqualify you.
These are things that disqualify you. If you're like over a certain weight, I'm assuming.
No, if you're under.
If you're under a certain weight.
Yeah.
If you are a certain age. If you have a certain temperature.
You can't be less than 16 to donate blood.
There you go.
And if you're 16, you need parental consent, I'm pretty sure.
Yeah. that was the answer.
Okay. That's so like, you know. Okay.
List 2 to 3 methods to collect blood and phlebotomy.
Phlebotomy.
Phlebotomy. No.
What does it say? Two.
Phlebotomy.
F or not. PHLEBO.
MOTOMY.
Let me see. They didn't spell it right. They put phlebotomy. There should be a B where that M is to say phlebotomy.
So this probably is not a...
Let's not do that, and let's just ignore like.
That's why you're getting.
I like
wrong.
the question though. I like the question thing. That's really cool.
That I'm asking you.
Yeah, that's cool. Like, oh, let's see how much you actually know about your job, you know, because you haven't been in school for so long.
Yeah, I think it's
yeah,
fun.
that's cool.
Okay.
Right,
Physicians call this lab requesting the procedure for a patient who wishes to donate his own blood before his surgery. This type of donation is known as
autologous.
Yes.
It's like basically a self-donation.
Yeah. I knew that. I can't say these words. PBT has just completed... No, we're not doing that one.
Why not?
Because I can't say these words.
It's okay. You can show me the question. Okay.
You have to read it out loud. Okay, last question.
Mm-hmm.
I'll try to read it.
Okay.
PBT returns to lab with a specimen for cross-match or compatibility testing and delivers it to...
Blood bank?
No.
They drop off the specimen.
Mm-hmm. PBT returns to the lab with a specimen for cross-match or compatibility testing and delivers it to...
The specimen. They deliver the specimen to...
Who are they bringing it to?
Should be blood bank.
What's another word for that, maybe?
Serology?
No. It starts with an I. It's very long. The word is very long.
Starts with an I. Is it like immuno?
Mm-hmm.
Okay, immunoserologic studies.
No,
something.
that's so wrong.
All right, what's it called?
It's this.
Immunohematology. That's a matter of opinion. Hematology.
I believe you, but Quizlets has you wrong. So I think
Okay.
your final score, I'll give you 4 out of 5.
Okay.
Even though I feel like that's not right.
Yeah.
But
And I did like a bunch of extra questions that I did get right. I'll take the 4 out of 5. That's okay.
fine. Should I say
No,
5
no,
out of
4
7?
No, 4 out of 5.
6 out of 7? Does that make you feel better? When I'm rewatching this and editing it, I'll let you know how many questions it was, and just so you know.
Yeah, thank you.
I got you.
Yeah.
Yeah, so that's all I have. Anything else you want to say?
Thank you for having me.
Thank you for listening to this episode of Young or Dumb. I hope you enjoyed the subject and learned something new. Make sure you like, subscribe, and leave a comment of a fact you learned or what you want to hear next. And remember, be happy and be chill.